Assalamu alaikum. Now, today's topic is neck pain. In neck pain, if you find a patient with neck pain, what should be your differentials? First of all, you need to sort out your differential. Like, if you get a patient with neck pain, first of all, think about all the S. That means strain, that means spondylitic myelopathy, that means spondyloarthropathy, if there is any sort of spinal metastasis. Then think about any sort of R, that means any sort of radiculopathy. Then you should think about any sort of itis, like vertebral osteomyelitis or facet osteoarthritis. So start with all the S. That means strain. Strain. First of all, if you find a patient with a strain, you have to take a history from the patient, that antecedent history of neck injury present or not, and pain or stiffness with neck movement. If neck movement, that means neck flexion, extension, lateral rotation, and lateral flexion. These are the movements done in the neck. And if there is pain over those movement, those neck movement, then you should think about any sort of strain present or not. Then again another S, that means myelopathy, spondylitic myelopathy. We know what is Lhermitte sign. In Lhermitte sign, also found in MS, that means if you flex the neck, there is electric shock like sensation over the neck. Electric shock like sensation over the neck area. It is called Lhermitte sign. And if there is lower extremity weakness or any bowel bladder or any gait dysfunction present or not, in myelopathy, you get this sort of feature like bowel bladder involvement, like gait dysfunction, like weakness, any sort of Lhermitte sign. If there is any sort of spondyloarthropathy present or not. In spondyloarthropathy, usually in spondyloarthropathy, young man, HLA-B27 positive, relieved with exercise, and relieved with exercise, prolonged morning stiffness, prolonged morning stiffness. These things may be present on spondyloarthropathy. In spondyloarthropathy, patient get relieved with exercise, like ankylosing or axial spondyloarthropathy, like AS patient, ankylosing spondyloarthropathy patient, you may get this sort of neck pain. There may be morning stiffness, HLA-B27 positive, relieved with exercise. If there is any sort of spinal metastasis, that means constant pain, worse at night, not responsive to position change. Constant pain, worse at night, and not responsive to position changes. Not responsive to position changes. This is called spinal metastasis. And then radiculopathy. What happens in radiculopathy? Pain radiates to shoulder or arm pain radiates to the shoulder or arm. There may be dermatomal, sensory, motor, or reflex finding, and there is positive Sparling test. In positive Sparling test, there may be lateral rotation, lateral flexion, and rotation, lateral flexion, lateral rotation, lateral flexion. These three things should be done in Sparling test. If there is positive Sparling, then you have to think about radiculopathy. So in radiculopathy, positive Sparling test. What happens in facet osteoarthritis? It happens in older individual. Pain and stiffness worse with movement and relief with rest. What happens in vertebral osteomyelitis? There may be focal tenderness, fever and night sweat, history of IV drug abuse, immunocompromised, and recent infection. These are the differential diagnosis of the neck pain. So I am trying to make it simple. First of all, think about S, strain, strain, in strain, injury, and pain and stiffness over neck movement. In spondylotic myelopathy, there may be lower extremity weakness, Lhermitte sign, and bowel bladder dysfunction. In spondyloarthropathy, think about S, HLA-B27 positive, uh, mm, history of morning stiffness, prolonged morning stiffness, relief with exercise. And in spinal metastasis, constant pain, worse at night, not response to position change. Constant pain, worse at night, not response to position change. After that, radiculopathy, presence of positive Sparling sign, pain radiates to the arm and shoulder, and dermatomal, sensory, motor, and reflex finding, and positive Sparling. And in facet osteoarthritis, older individual, pain and stiffness worse with movement, relieves with rest. And in vertebral osteomyelitis, there is focal tenderness, fever and night sweat, IV drug, IV drug user, immunocompromised, or recent infection. And this is all about neck pain. Hope you enjoyed.